And welcome to tonight's GMB live discussion on looking after your mental health during COVID-19. My name's Nell Andrew and I'm the National Quality and Inclusion Officer for GMB. So I'm here tonight with Barbara Plant, GMB National President, and Dr Rosena Allin-Khan, MP. So tonight we're going to be talking about why mental health in the workplace is such an important issue, why COVID-19 has made it an even bigger issue for so many people, and why trade unions and the Labour Party need to be addressing and organising around this now. So we all know the stats that at least 1 in 4 people will experience mental health or neurological disorders at some point in their lives. But as a union, GMB know that with the impact of austerity in recent years and the current coronavirus pandemic, mental health has become an even bigger issue for our members, both at work and at home. In May, the Royal College of Psychiatrists forecast a tsunami in mental health illness after lockdown. And that certainly chimes in with what our members and reps are telling us. We know that issues like fear for people's health, the health of their loved ones, the stresses for key workers facing this during the pandemic, increased economic uncertainty, the difficulties of isolation, and the lack of support networks, amongst many other issues, means that many workers are talking about mental health impact of the crisis. And rightly so, there's been a lot of focus on physical health and well-being, but we know there will be a long-term mental health impact, which will need serious solutions. We also know that this will have a varied impact on different people. For example, key workers will face particular demands, Black and Asian, minority ethnic, and parents, disabled people, furloughed staff, self-employed people, and LGBTQ plus communities, which is particularly relevant on the last day of Pride Month. So this evening, we'll be looking at what actions do we think employers and the government should be taking to protect workers' mental health. We'll be discussing the scale of the issue and how this is affecting different groups of workers. We'll also be hearing about unions and the Labour Party. What are they doing to improve support around mental health for workers and their loved ones? So hopefully this is a really timely discussion where we can talk through the issues and think about the actions we need people to take. Now, if you're new to Facebook Live, like me, underneath this video should be a comments box with a live feed. We'd love to hear your thoughts and questions for our speakers, and I'll try and read out as many as I can in the next 45 minutes. So to our panel, we are extremely pleased to have Dr Rosena Allin-Khan, MP, with us for this discussion. Rosena was elected Labour MP for Tooting in 2016. Before becoming an MP, Rosena worked as a doctor and continues to do shifts in Tooting A&E. So she really knows what's going on in the front line of our public services. She has been an unrelenting voice, calling for better support for frontline workers in the fight against corona, including on PPE and testing. Rosena is also a GMB member, which is fantastic, and has been actively involved in a number of GMB campaigns, including our successful campaign to stop redundancies amongst facility staff at St George's Hospital. Rosena was recently appointed as Labour's Shadow Minister for Mental Health and has absolutely hit the ground running, working with GMB members in the NHS and care on what mental health support those key workers will need from employers and the government. We're also really happy to have our brilliant GMB National President with us, Barbara Plant. Teaching assistant and became involved in the GMB when her head teacher started to impose changes on her and her colleagues. The school wanted support staff to administer intimate medical procedures, and Barbara and her colleagues stood up and challenged those changes. When she succeeded in getting those changes dropped, she became a workplace rep and was then the school's convener in Lewisham for a number of years before being elected as the National President of the Union in 2018. So Barbara recently wrote a very moving blog post on how we process grief and loss, which I know sadly will be an issue affecting lots of members at the moment and people watching tonight. We will add the link in the comments so you can read that blog post at your leisure, but please don't leave us just yet. So again, for those of you watching this on Facebook Live, can I remind you that you can take part in this discussion in the comments on Facebook. It would be great if you had any questions that you'd like to put to Rosena or Barbara to answer, and you can feed your questions into the comments box and we're putting those to the panel in a minute. So thank you both for joining us tonight to discuss such an important issue. It's really appreciated. I think, Barbara, you're going to kick us off. Barbara, I know that mental health is something very close to your heart, but why do you think mental health is such an important trade union issue? Why should GMB be campaigning around this?
Thanks, Nell. That's a nice, easy question to start with. Mental health is a trade union issue. It's a workplace issue and one that we can organise around. It's also one of the hardest issues for any GMB rep to have to deal with when they're supporting members. I'm not an expert by any means on mental health or mental health conditions, but I've been a rep for 18 years. And so I know only too well why we need to campaign on mental health. As Nell said, I've got a background in education and I've been seconded to my branch since 2009. And in that time, I've represented many members in local government and schools on all kinds of issues, grievances, disciplinaries, ill health capabilities. And I know how hard it is for people to talk about mental health issues, their anxiety, their depression, their work-related stress. But I've also seen the very poor responses from managers and employers. And also during that time, I've seen the impact that government cuts have had to schools. So staff being made redundant, but also seen the impact that has on the workload for the staff of those who remain. I've seen the rise in temporary contracts, the 0-hour contracts. I've seen the effects of austerity on the local services, on the NHS, which means I've seen the cutbacks to mental health services and the growing waiting times for those suffering from mental ill health. So when members, are sent for counselling, the waiting list is horrendous and they don't get help for often many months. But just like physical ill health, mental ill health affects the ability of our people, our members, to do their job. And if they end up being sick for a long time, the likelihood is that they will be taken down the ill health capability procedure, dismissed, and then spiral downwards even more into deeper and darker depression. And I've seen that happen, and I've supported members in those circumstances and had some threaten to take their own lives. And it's also, mental health is also an issue that is very personal to me, as Nell said. It's close to my heart. My son took his own life in 2015. And you can't imagine the guilt that as a mother you put on yourself, but also other people put on you as well, because there's quite a lot of judgment going on about your qualities as a parent when that happens. And for that reason, I joined a bereavement group to get my own support. It's called the Compassionate Friends. It's a bereavement group run by bereaved parents for bereaved parents, and it's a particular group for those bereaved through suicide. And many of those many of the people I've met are now suffering from post-traumatic stress disorder following the death of their child, but they are still trying to keep their job. And actually in that group, I've become the kind of trade union advice rep in an informal way, telling them how to apply for flexible working, because a lot of them can no longer feel able to work full time, making sure they put things in writing to their employer, telling them, they need to know the policies and giving them advice about being taken down a capability procedure. But my overwhelming advice is always join a union. Because, like I said, it's a workplace issue. And if you've got a member that's going through a really difficult time, and I've sat in many meetings with members, and I've heard a manager, an employer say, well, you've just got to find that switch in the back of your head that says, you change your face from an unhappy one to a happy one when you come through the school gates. And these are people or women going through domestic abuse, for what, in some instances. And it doesn't work like that. There is no magic switch in the back of our heads, that we can just turn on and turn off when we want to. But it also is a collective issue. That's why it's another, trade union issue, because we're all about the collective and the strength of being in a trade union. Because if one person is experiencing that kind of treatment at work, then you can bet your life that other people. Trade union rep, it's about ensuring that there is good practices in the workplace. Because this is about preventing issues in the workplace, and prevention is always better than cures. That yes, they could be support mechanisms, but we want to prevent work-related stress. We want to prevent the issues that crop up in the workplace before. And even in normal times, as we, pre-COVID, we worry about things like our health, our jobs, our money, our benefits. So in times like we experienced during this COVID, where people have been working from home, isolated, being furloughed, worried about the threat of redundancies, worried about themselves, their loved ones getting ill, or those who have been key workers working without the correct PPE, there has been an enormous increased stress and anxiety and possible depression. So we need, as trade union reps, to make sure that employers are exercising their duty of care to staff in these difficult times and all times. But the world of work needs to change, and that's why we do need a government, a Labour government, that will bring in better employment rights, put money back into public services, bring the contracts that have been outsourced back into house, and make sure there's better pay and sick pay from day one, so that people can actually afford to take the time off to get better, and improve our mental health services so there aren't these long waiting times. And I know this is where Rosena comes in, and it's great to have a shadow mental health minister. And I know she's got lots to talk about that and the Labour Party proposal. So thank you, Nell.
Well, thank you, Barbara. I mean, I think there were some really important points there, thinking about why this is a trade union issue, why we must campaign, and how much sort of mental health representation in the workplace is on an individual basis, is about supporting that individual. And while that is right, we have to have a collective approach to this. This is the only way we're going to change things. That and working to get a government that is going to listen to us. So that does take me really neatly on to Dr. Rosena there. So Rosena, thank you so much for joining us today, and congratulations. Congratulations on your appointment as Shadow Minister for Mental Health.
Thank you so much.
I was going to ask you about, how do you see the role and what have you been working on? But I think the cat's out of the bag a bit, really. We've had a really exciting announcement yesterday on the Care for Carers. Please tell us a bit more about that.
Thank you. Oh, well, first of all, a massive thanks to you, Nell, for hosting this today, and thank you to Barbara. Barbara, your incredible bravery and speaking out about your own personal issues is what will show so many other people that it's okay to start talking about mental ill health. It's okay to normalize things that people have been feeling for decades as though they just cannot talk about. And I'm really honored to be here tonight. I'm really honored to work with GMB, to be honest. And I am really excited about our announcement yesterday, which was the Care for Carers package. I'll tell you a little bit about what actually got me to that place and how we got there. But ultimately, it is not any kind of big news to anyone that I'm a doctor. I think I spent most of my deputy leadership campaign reminding everybody of that on a daily basis. And I'm a proud frontline NHS worker. And obviously before becoming an MP, that's what I did all of the time, but I've never ever given that up. And going to work in our NHS during this COVID period really illuminated to me some of the hardships felt by our frontline staff. I then thought, look, is this just my own experience or is this shared by many others? And so through talking to GMB members and reps and holding a series of discussions, I was really able to understand the extent of the mental ill health felt by so many frontline workers for a number of reasons. And I'll give you some examples. There are people who work going into our hospitals, working to serve people food and to clean the wards. Some of those members were being asked to go in and clean rooms where someone had died of COVID, and they were asked to go in without appropriate PPE. The anxiety that this caused them, knowing that they were potentially A, catching the virus themselves, B, spreading it from patient to patient, because if they weren't wearing appropriate PPE and they were going into one room and then going somewhere else with other patients, they could potentially spread it. And thirdly, taking it home to their own families. On top of this, you had doctors and nurses going to work every day, feeling as though they were putting their vulnerable family at risk when they came home. I know myself, I would walk through the door, literally take all my clothes off, jump in the shower before I'd even hug my children. I had to phone home before going home and saying, can you please keep the kids away? And having that, how do you have that conversation with a 5-year-old? You can't hug mummy. And those sorts of things were very taxing, on people. And then the repeated onslaught of going to work every single day for frontline workers, and some of the GMB members, some of our paramedics were talking about just how much they were suffering, knowing that they were told not to go to certain patients because there were just too many of them, and X or Y patient would have no chance of surviving anyway, therefore they should focus attention elsewhere. The emotional drain that put upon them, the strain on their mental health, on top of exhaustion, on top of people having to break people's hearts over the telephone and seeing families torn apart, and add into that carers in a very fragmented system who were doing anything from working in care homes to going in as domiciliary care. People just weren't getting the support that they needed. And so this spurred me on to work with GMB to come up with a package called Care for Carers, which we announced yesterday. Now, to be very clear, this is not saying that it's only our frontline NHS and care staff that need mental health support. It's about saying we already have an under-resourced, overstretched NHS. We already have a mental health service that is unable to provide the timely service that our communities need and deserve, because they have been so drastically underfunded for the last 10 years. This is not about saying that there's one group of people more important than the other. It's about saying, what can we do to provide a service that can deal with timely, complex PTSD, post-traumatic stress disorder, that people are suffering now, while also not adding extra strain to an already strained service. You know, there are so many people out there at the moment that are suffering with mental ill health, that have had that long before COVID. You know, issues that have been exacerbated by lockdown, by not being able to get peer-to-peer support. And on top of that, you have a workforce that have been scared to go to work, been scared for their own health, and many who've had to say goodbye to their colleagues. Can you imagine what that's like, going to work, having lost your pregnant colleague or having lost another colleague? And our BAME community members feeling as though they were utterly let down by a government that knew the risk they were under and didn't put measures in place. So all of this has meant that the strain on the mental health of our frontline NHS and care workers has been immense. And together with the GMB, we've come up with this package, which would, look, you know, ultimately, I wish we were in government. We're not. This is something that we're going to push the government for. And it is a 24-hour telephone hotline, because obviously we're all shift workers, many of us, you know, that people can access at any time, day or night, where there's somebody trained on the end of the phone to provide emotional support, or to say, I'm really worried about this person, and plug them into services where they can get sessions of support that they need. And all of this without people having to directly go to their line manager, which we all know is a problem. And, you know, when I spoke to GMB members, they also highlighted that is part of the anxiety. Part of the anxiety is telling people that manage you, I'm worried about my mental health, because they're worried that will affect them in the workplace. But I'm also really glad that there are people in GMB who are kind of, you know, mental health champions, you know, sort of like taking it forward, you know, as reps. People are taking this very, very seriously. And it's just an honour to really be working with GMB. And I think we are at a pivotal moment now where together, you know, the trade unions and the Labour Party can work synergistically to improve lives for, you know, for everyone. And I'd say this, you know, people should join a union. It's so important, because look, I remember my mum, she worked in very precarious work circumstances, and, you know, she had 2 kids and she worked 3 jobs and she was on her own. And I remember just how difficult it was as a family. And if only I'd known about unions back then, if only she'd known, I'm sure our life would have been different. And so I would implore people to, you know, if you're watching this and you haven't joined a union, do join, because, you know, as Barbara said, it's so important. So much can be done to support you. And hopefully this is just the start of what we can do for our GMB members and wider community for their mental health. So yeah, it's going to be an ongoing journey. I'm excited to be part of it, and just in 2 months of having the role, we've been able to come up with this. So now the job is to push the government into submission, and let's get it rolled out.
Well, thank you so much, Rosena. GMB is so excited to be part of this, and I know how important this was for our reps, for their experiences, their concerns, to be directly shaping Labour Party policy and hopefully wider legislation. So this was massively important, and that's how we work. We are member-led, and so I'm so glad that those discussions were able to take place. I just wanted to go back a step, something that you touched upon there. You know, we know that COVID-19 has massively, disproportionately affected Black, Asian and ethnic minority communities. You know, with the risk of death for people of Black and ethnic minority backgrounds being twice as great as men, twice as great for men and 1.4 times greater for women compared to their white colleagues potentially. And we know that this is causing huge stress and anxiety for BAME workers, understandably, as you said, with colleagues dying around you and those concerns of taking the virus home to your family. What should trade unions and the Labour Party be doing to highlight this issue and help support these workers? Where do you think this needs to be going?
So it was really interesting, actually. We had a debate which I closed for our party just 2 weeks ago on the COVID-19 crisis in our BAME communities, and I think so much of it comes to really calling for risk assessments, not just to happen in words, but to happen in action. It's so important that risk assessments are done, and it's so important that we protect people's working rights, because we hear stories all of the time. I mean, it's actually very common to hear stories of people admitting that they were asked to go and do things in a way that their white colleagues were not asked to go and do. There are stories, you know, real life examples of people saying that Black and Asian members of staff were not given scrubs. They were told to take their dirty uniform home and wash it, and white members of staff were given scrubs to change into. This isn't okay. And disproportionately, when it came to not having enough PPE and people having to go and do a deep clean of a hospital side room where someone had died of COVID-19 without PPE, it was disproportionately Black and minority ethnic people that were asked to go and do that. And if you look at how the inequalities are laid out in our society, it is disproportionately Black and minority ethnic community members who are going to be living in multiple occupancy houses. They're going to be afraid to even admit they've got symptoms because they're thinking, well, how do I feed my kids if I'm not at work? We can't be making people feel as though their working circumstances are so precarious that they cannot say, I can't come in because I have got symptoms of COVID-19. People are having to make unenviable choices of choosing to feed their family or go into work with symptoms.
I mean, it's just unbelievable, isn't it? I mean, I know this is the lived experience of many of our BAME members, but it never stops being shocking. You know, what we're talking about is institutionalized racism, structural and systematic racism. And I know that there are a lot of myths around the reasons why BAME workers have been so affected. Going and thinking about this from a mental health perspective, again, recognizing why people right now are more likely to be impacted around mental health. But do you think there are issues to be addressed around how people from BAME backgrounds access mental health services and how possibly those mental health services and other services interact with them? So I'm thinking, you know, race health inequality was already an issue before COVID-19, for example. You know, where do you think some of those barriers are?
Well, I think it starts really very young, to be honest. It's very difficult for people to access CAMS services, child and adolescent mental health services. It's very, very difficult. And we know that the checklist of criteria before you can even get on the waiting list is as long as your arm. And we know that disproportionately young Black men first get identified with having mental ill health when they're already within the judicial system. So we need to be working, and I have been working interdepartmentally with our education team, with our housing team, looking at the drivers of health inequalities in the first place, because we've got to get it right from the beginning. But also it's about stigma. In a lot of communities, they're just not, in some languages, there just isn't the word for depression, because it's seen to be a sign of weakness. And also, I appreciate that it's not just our BAME communities and unfortunately Barbara knows this all too well, but disproportionately young men are taking their own lives. And we need to say, what can we do differently? What spaces can we create for young men of all backgrounds, young women, everyone, to feel as though they can talk about why they're feeling unwell, so that there can be intervention before it goes too far. And so much of that is to do with things like job insecurity, things to do with self-esteem, things to do with stigma, and it needs to be addressed from a really early age. I personally would like to see it on the school curriculum, that, you know, we have like PSHE in schools, for, you know, safe sex, for, you know, like girls getting periods. We need to be making it normal to talk about your mental health from primary school. And so I feel very strongly about that. So I think there are many things that we can look at doing. It's also about involving our community groups. I know that my local mosques are very, very active in trying to reduce some of the stigma in some of our Asian communities, because we have to remove that idea that talking about mental ill health is a sign of weakness.
Absolutely, absolutely. And I think what you were saying there about recognizing, you know, when this starts, but also our reactions. Are we really listening to BAME communities when they're saying that there are issues around mental health because of the way that COVID-19 is affecting them? Or before that and beyond, how other issues of racism, health inequality, promotion opportunities, training, all of these sorts of things creates an impact, creates those barriers for people.
Exactly.
And I know GMB is taking this issue very seriously, and I wanted to bring you in there, Barbara. We've obviously just started this work.
Yeah, no, I just want to add that it is an issue we take very seriously as part of the whole wider support around the COVID-19. But we're working with our BAME members because they'll be able to tell us the appropriate support and health and safety measures that we should be campaigning for and asking for in the workplace. So we are doing work on that, and thank you, Nell, and to all the other regional equality officers that are leading on that.
Yeah, and I have to say I've been really impressed by how serious GMB take this, not just at this time, but you know, through the other campaigns with which I've been involved with. You know, particularly, you know, local, like potential industrial action at my local hospital, you know, from like the Mighty staff there. These were disproportionately BAME members. And it's very difficult to feel as though you have a voice sometimes, particularly if English isn't your first language, if you are worried about your job security, if you are worried about your family. And I know that GMB, you know, really do go into bat and take this incredibly seriously, which is why, you know, naturally it was fantastic to work with you guys on creating the Care for Carers.
Absolutely. Thank you for that. I mean, I think if you're watching this and you're not a trade union member and you want a voice in your workplace, in your industry, in government, now is the time. Arguably, in our lifetimes, there has never been a more important time to be a member of a trade union. So if you're not a member yet, you hear what's coming. For more information on joining GMB, please go to www.com at www.gmb.org.uk/join-GMB for more information. So that was my little plug there. We've actually had all kinds of fantastic comments. So thank you so much for everyone joining us on Facebook Live. I want to do a couple of quick shout outs to members joining us. Shout out to Amir, our GMB rep for BA Gatwick, who's joining us. So there were huge issues for GMB members based at Gatwick working for British Airways. So we sent all of our solidarity to you and your colleagues as you fight British Airways and what they're trying to impose. I want to also do a big shout out to Dawn, who's one of our National Equality Forum members and is also a branch president at GMB Z60 Lincoln. She's a rep, she's a registered nurse in mental health. So fantastic to have you with you, have you with us, Dawn. We've got Shona from GMB Glasgow, who's also joining us. And Shona is one of our absolutely fantastic reps who led our amazing Glasgow women's strike, which was just, you know, amazing. We've also had a really good question, and I think I'm going to move on to some of the questions we've had through Facebook. I'm going to start on one of the questions we've had, really specific and medical. So I'm probably going to give this to you, Rosena, to speak to, Rosena, to begin with, which is, we've a member saying, I have PTSD and I'm being made to wear a mask at work. Is this allowed? It's quite a specific mental health question there.
Well, without knowing the details of what's what's causing the PTSD, I am assuming that it's related to the COVID crisis and being and like wearing a mask is part of what's triggering it. I think it's really important, if that is the case. I think first and foremost, it's about safety, your safety and patient safety, or those around you. And if it is safest to wear a mask in that environment, then obviously that's what's necessary. But the question here is, perhaps you should not be in that environment right now. If you have PTSD and wearing a mask triggers you, that is detrimental for you. And it would be really important that your PTSD is dealt with. I know how traumatic PTSD is, I really do. And I think it's really vital that if you are a GMB member and you have a local rep that can help you discuss with your line manager, maybe ways in which you could, if possible, work in another part of the department or like workplace that doesn't require you having to wear a mask, or maybe you need some time off work. These are things that I don't know without having a detailed discussion. All I do know is that if you have got PTSD and wearing a mask is triggering that, then we do need to look at options as to how you don't have to be in that space in the first place.
Absolutely. So a lot to consider on that. I want to do a couple more shout outs, and then we've had some more questions, which is just fantastic. There's some questions. There's a shout out here from Paul, who is saying about GMB's approach to this issue, that it's great to hear GMB President sharing personal and collective importance of mental health, massive health and safety issue. Glad GMB don't follow sticking plaster approach of first aid. We need to tackle bullying and other stresses caused by bad management, which I think is absolutely right, Paul. Thank you so much for your comment. We've got a load of questions here. There's a really good one here for Barbara about workers in schools from Kate on our Facebook Live. Hi, Kate. She says, my school is forcing employees to come in even when they're feeling anxious and know that people are breaking risk assessments at work, left, right and centre. We feel very bullied and people hate us for not going in. What would your advice be there, Barbara?
I think if this is a collective issue, then if there are if she's saying that this is something that management are forcing lots of people to come in when they're feeling anxious, then obviously this is about sticking together and making your voice heard as a collective voice. It's obviously also, if this risk assessments are being not followed, then you've got a very good case for, you know, health and safety, that they are not following their duty of care. And you can take out a grievance. Obviously grievances take a long time to process, so this hasn't got that kind of, you know, immediate effect, but in the long term that is what people should be doing, is taking out a grievance, a collective grievance, because there will be, as you say, lots of people in this same situation. But if people are not feeling, if they feel anxious, they need to express that in writing to their manager, not just to have phone conversations with the manager and then the manager to say, well, if you're feeling anxious, you know, because I've heard this as well, why don't you look for another job? That's some of the responses that managers will say to you. And you need to sort of say, you know, I'm going to write this in writing, I'm going to put this in writing to you because I am feeling anxious, you're not following the risk assessment. And then the response should be back in writing to what they're going to do about it. And they're not going to put that in an email, I can tell you, because you know, they know that to put that in an email would just be, so there are little things you can do, but you know, it is about that collectiveness, and make sure that you are sticking together as a group of workers and employees that being misused by a bad management.
Absolutely. It's about sticking together, isn't it? It's so easy to be picked off as an individual worker. It's so easy to be dismissed about fears or about concerns, or to have pressure put on you. Whereas we stick together as a trade union, when we have our reps go in there and say, we're not having this, we're not having workers going back without proper risk assessments, then it's a whole different ball game. I've got in fact, which question shall I go to next? So I think we've got a really good question here. Actually, we had some members, some reps send in some questions earlier around someone saying, I've had some time off over mental health issues and my employer is trying to discipline me for it. I want to get back to work, but I need them to be more understanding. How do I get them to take on board what I need? Which is kind of foot coming on from what you were saying there, but when people have actually had to go off, and we know an awful lot of people have had to take time out for a variety of reasons because of mental health, what do we think about getting people back in the workplace?
Do you want me to come in first?
Yes, please, Barbara.
No, and I'm sorry to hear that. And but again, it's about what policy are your workplace following. They should have, obviously, if they're taking you down, I would have thought the ill health capability policy if you're being off for a while. But have they got a mental health policy? Have they sent you to occupational health? If you've been off for a number of weeks, then usually the procedure is that they would send you to occupational health. Occupational health will then determine whether you're fit to go back to work. That will trigger a meeting with your manager. But if you're in the union, you've got the opportunity to take your rep. So my advice is never go into a meeting on your own. If you go into a meeting where there's two people, there's the manager and there's HR, or there's a manager and somebody else there, and you're alone, then advice is always, you're outnumbered, and therefore you need to take your rep in there with you. So that's my first advice, is to find out what policy they're following. Have they sent you to occupational health? Once they've sent you to occupational health, that should then create that opportunity to meet with your manager and discuss what the occupational health has recommended. They may well be recommending a phased return, or some sort of different, role for a little while until you get back on to get back. And that's that. Then you can start, having that discussion. So as Anna said before, with your manager about the best way to get back into work.
Absolutely, as always, Barbara, solid advice. And we've had loads of comments and loads of questions, which is fantastic. Please keep them going, folks. We're going to take a question that is from Rosena's Facebook, from Charles. Hi, Charles, which says, workplace training in mental health is a life skill course that can not only support organisations be great places to work, but staff take that training into the communities in which they live, for their friends, family, and maybe the confidence to support even a complete stranger. So I think that's a really, really good comment there, thinking about actually the role of training. And I know that we've had discussions before about some of our concerns about how mental health is often done in the workplace. Maybe if we widen this out and think about, what is the bigger picture? What are we expecting to be available in terms of from employers, and what should the government be doing to protect against a mental health crisis? We talked about this earlier, that's looming. So what can be done in workplaces to prevent mental health, prevent people hitting crisis, and what should our demands be to government in terms of protecting against a mental health crisis? Rosena, do you want to come in first?
Yeah, thanks. I mean, that's a really great point, Charles. I mean, personally, what I would like to see, I certainly know that every single time you go to a new hospital, you have an induction day, and your induction day is how to wash your hands safely, how to move and handle, patients, fire safety training. And then as a professional, you have to do your child safeguarding course. These things are all mandatory. I personally would like to see, like mental health support training in the workplace as a mandatory thing that everybody has to do when they start somewhere, because I think that will be a really good way to signpost what's available within a workplace. It will also show people that the organisation where they're going to work takes this extremely seriously. And in fact, I think this is something that should be sort of enshrined in law, just like everything else is. I think it absolutely should be mandated that this is what happens. And I think with regards to the government and our asks, I mean, quite frankly, if I'm honest, we've had 10 years of drastically underfunded, under-resourced mental health services. We have an issue with workforce in our mental health sector. And quite frankly, there just aren't the resources available for everyone to have what they need. But I think that we need to change the culture of how we address mental ill health. We need to make it as acceptable to phone work and say, I don't feel well. I don't feel well enough to come into work. From a psychological point of view, that has to become as normal as I've got a chest infection or I've got diarrhea and vomiting. It has to be that acceptable. And people have to not have that fear of it sort of marking them and their whole working life forevermore. I mean, you speak to people in the construction industry, they are the most afraid group of people to talk about having mental ill health, because then they're worried that they're not going to get awarded on the next contract. It's such precarious work that we have at the moment as well. You know, 0 hours contracts, like precarious work that means that people are not going to admit they've got a problem because they know that they're only as good as their next contract. Or, you know, they're worried that their boss at Amazon just isn't going to give them any more hours because they've admitted to not coming into work because they're grieving, or they're depressed, or they've got anxiety. And I think post-COVID, we're going to see this more and more. So in summary, we need to normalise training in the workplace and make it mandatory. That has to be enshrined in law. And we have to protect workers against being discriminated in the workplace because they have admitted to having mental ill health. And I think if we did that and people felt protected in that way, they'd be more likely to be honest about it. And actually, they would take less sick days, less mental health sick days. And our Care for Carers, actually, when we were sort of doing all the research, we discovered that the NHS could be saved £150 million a year if everybody that called in sick due to having mental ill health just took 1 day less off per year.
I mean, that's an incredible figure there. And I think some of the things that you flagged up there, Rosena, are around stigma, and stigma being such a huge issue. We've got, and I'm going to come to you, Barbara, in a second, but Julie on Facebook, hi Julie, has put a really great comment here about too many staff don't self-declare their disability, such as mental health issues. And if managers aren't aware of a staff's disability, they can't implement reasonable adjustments. And we know that around reasonable adjustments, there are huge difficulties in workers having to constantly fight to keep those reasonable adjustments. But if you haven't informed your employer, if you don't feel that you can, if you don't feel you're going to be supported, then that's a barrier in the first place. So Barbara, I know that you and I have had lots of discussions around what needs to happen in the workplace and what needs to happen in government, but I don't know if you wanted to pick up there on some of Rosena's points about potentially a preventative duty, you know, comparing this to other areas of either disability law or thinking around health and safety, perhaps.
Yeah, no, just to pick up on some of those things. I mean, I think there needs to be better training for managers in the first place, because I don't think a lot of managers understand their duty of care, and they don't understand the Equality Act, and they don't understand how to do good risk assessments, and they've never been trained to do them. So, and they don't understand what that phrase reasonable adjustments means. But also, until there has to be this matched with it coming from government legislation, because we've got the Health and Safety Act, where you've got health and safety and welfare, and people and employers have to report things that under RIDDOR. So, you know, reporting diseases and, you know, dangerous occurrences, but we don't have to report anywhere work-related stress. So until managers and employers are forced to act and actually have to share that data with anybody, they're not going to be, you know, do anything. So it would be really good to see that Health and Safety Act matched with something like a Mental Health Act, where employers have to have that obligation to report things, and then to you know, show what they're doing to improve the welfare of their staff, because it is health and safety and welfare, and that welfare includes not just physical welfare, because lots of people talk about, you know, if the physical aspect of looking after somebody, but that includes the mental welfare as well.
I mean, I think you know, do we think that mental health issues are becoming more accepted, are becoming more common? You know, we see a lot around mental health first aiders. Do we think that actually things are getting better in terms of stigma? There's still a problem, but is this better compared to, say, 10 years ago? Rosena, should I hear from you first?
I'd say deep down, stigma really still is a huge issue. I think with having a few celebrity voices talking about mental ill health more recently, it has helped. It's helped to, you know, talk about mental ill health as more a normal general part of conversation. But I'd say amongst some of the peers that I grew up with, some of my friends, you know, people from from certain backgrounds, you know, working class backgrounds, it's not something you talk about down the pub, is it? You don't say, "Yeah, you're right, how's it going?" Or, "By the way, you know, I felt so bad the other day, I thought about taking my own life." "Oh yeah, oh really?" Yeah, it's just still, you just wouldn't do it. And I think we need to, I think some people are starting to feel safer amongst people that they feel won't judge them, but there is that wider sense of being judged, I think, and that is still a huge issue. And I personally, just my personal opinion, and I don't know if Barbara would agree or not, but what I've experienced in a workplace, or even just having this role, when I look at who pays attention, it's usually the most attention is paid by people who have had a lived experience of mental ill health, or who have had a close friend or family member. If somebody hasn't, I find it still very difficult for people to truly understand, because it's a bit esoteric, isn't it? Like it's not that straightforward to sort of imagine what it would feel like to feel that way. Until you've lived it, you don't really understand it. So we need more people talking about their lived experiences, so that people can almost normalize them as actually, yeah, 1 in 4 people suffer with depression. Like, we know this, but most people couldn't name 1 in 4 people that they know that have it. So we have to make it easier and safer to talk about it.
Absolutely. We can't rely on the experience of a few individuals to be leading that really good work. And I think there's that huge issue, isn't there, about actually asking for help as being one of the most difficult things to do, of putting your hand up and actually saying, as you said, I'm in crisis, I'm thinking about taking my own life, I need help, I need support. And that in itself is one of the greatest difficulties of people being able to flag up when they're sinking, when they're having a bad time. Barbara, just thinking about from employer attitudes, do you think employer attitudes have really changed in the last 10 years towards mental health? You know, do you think it's a real meaningful change, or is there a lot of buzz? I'm leading the question here, but what do you think?
No, I'd like to say there has been, but to be honest, no.
Yeah, I'm a Barbara.
I've seen, I mean, when I worked as a teaching assistant, working in a primary school, we had a whole thing about well-being. And that was the buzzword, you know, well-being. And I don't know what it means. It's kind of a bit meaningless of a phrase. It's not very specific. And basically what it meant was that on a Friday afternoon, we would get donuts in the staff room, and there'd be some magazines to read on the table, and we'd all feel great on a Friday afternoon. But you'd come back to work on the Monday, and then it'd still be the same issues and the same things that hadn't been sorted, and the same lack of care for the rest of the week until Friday afternoon came round again. And I know that lots of employers are doing things that are sort of reactive, and I'm you know, in terms of putting in support, and maybe the mental health first aiders, which has a place maybe, but it's about preventative measures, and I'm not seeing those from employers. I'm not seeing preventative measures. It's still very much about the reactive, wait until somebody comes with a problem or being off sick for a long time, and then we'll see what we can do to deal with it. So no, I'm not
The short answer is no. I mean, I think some of the things that we've talked about between the three of us before is, you know, if there is a fire in the factory and people die or are badly harmed as a result of that, you know, we don't have more discussions around we should have some more first aiders. We say, what went on in that factory? We need to stop fires from happening, full stop. And we're seeing fires in terms of mental health crises across the country. Our members and our reps often say, you know, there are 6 or 7 members that I am supporting at the moment who are really deep in crisis, who are considering taking their own lives. And when we talk about, well, what has the employer response been? They've wanted to individualize it, or they've wanted to say, you know, if you thought about meditation, or if you thought about counselling. And while, you know, different forms of support and therapy can be useful, what is going on in those workplaces where 6 people are experiencing that kind of crisis? We need to be thinking about, again, more collective responses. I've got a load. I'm mindful of the time, folks, so I'm going to read a couple more shout outs and then a couple of questions, and then maybe we can kind of sum up and come to our action points. We're trade unionists. We like action. We like, what's the plan? What are we going to do? Just a quick shout out to, it was great to have Charlene from Southern Region. Hi, Charlene. Great to see you. Charlene's from Southern Region. She's doing some brilliant work representing members across South London. And she's been saying, you know, a mental health charter might be an idea. Dawn, again, has been saying, I've had a manager comment to a member in a return to work interview, mental health isn't like cancer because you can't see it, which is a very odd and I would say unhelpful comment. And then I've got a couple of questions here, some really good ones from Georgina. Hi, Georgina. Thank you for your question. Georgina is a carer returning to work after shielding, and she wants to know what support her employer should be putting in place. So maybe that's one for Rosena. And then another question that I'm going to give Barbara time to think about is a question from Kareth. Hi, Kareth. Kareth, fantastic member and activist. Kareth saying, probably again for Rosena, but also for Barbara, it's spot on that mental health needs to be addressed and discussed in every workplace and in school from day one. Is there anything else we can do to encourage the cultural shift we need to prevent support on mental health? So two questions there. One, somebody returning, a carer returning to work from shielding, what sort of support should be put in place? And then I think for both of you thinking around, you know, mental health needs to be addressed. What else can we do to kind of shift that culture, to change things? And then I think we should move on. So Rosena, do you want to go for it first?
Yeah, okay, I'll try and keep my comments brief. So obviously with anyone shielding, there have to be risk assessments done. I mean, that's the main crux of it. And I think that anyone would be perfectly within their rights to not return to work until a risk assessment has been conducted. And as Barbara says, if there's any pushback, get it in writing. I've spoken to people who have said that when there was pushback, they put it in writing, and then all of a sudden things changed. And I've heard of, you know, some nurses who flatly refused to go back to work. Hard as that is, that's the only way to do it. You've got to put your health first. But you're not alone. You're not alone. If you remember, you know, you've got a rep that can support you through this, and you have rights. So risk assessment all the way. What we can do, I think so obviously the schools issue is huge, but I also think our community groups, there are lots of them, and there are churches, mosques, temples, all sorts of different community groups. We've got, you know, social clubs around the country. I think it's really important that we do whatever we can to ensure that any community leaders have got this on their agenda. And I think that's where we as a collective can do it. You know, if you're part of a church, you know, go to the pastor or the reverend and say, look, can we do a sermon on mental health and, you know, like stigma and talking about it? You know, in the local mosque, you know, can we do like a sermon on a Friday prayer talking about mental ill health? So start to normalize it in the conversation in our community groups. And slowly but surely, people will start to, you know, see people on the telly talking about it. You know, people like my friend Denise Welsh, who talks very openly about her depression. You know, people on the telly, people in the church, the mosques and social clubs, and people at work. Well, actually, maybe it's okay to talk about it. There'll be a cultural change. It will take time, but we can do it together.
Absolutely, we can do it together. Same question to you there, Barbara, or two questions there. Thinking about Georgina going back after shielding, the measures that she put in place, and particularly thinking about that kind of cultural shift. What can we be doing? How can we be changing this together?
Rosena said it's about risk assessments. It's about those, but also individual risk assessments. It doesn't, you know, it shouldn't just be a generic one. If you've been shielding and got a very specific risk, then that should be taken into account. So it should be an individual risk assessment, and to, you know, making sure that you've got all the equipment that you need and all the protection that you need if you're going back into that situation. And in terms of the cultural shift, I mean, it took a long time for me to come out and talk about my son's mental health. And I think having done it and having been able to do it, I've got through my own kind of stigma about sort of people, you know, reaction and judgments. And I think it's just maybe incumbent on all of us to be able to find that bit of bravery in ourselves to share our stories, because I think, as Rosena said earlier, I think listening to other people's stories means you're connecting with somebody that's had an issue or you know, had or know somebody with a mental health issue, and therefore you can begin to sort of, because it was very interesting when I said about my son taking his own life. Suddenly somebody else said, my brother took his own life, but a long time ago, and I've never told anybody. And then suddenly this was now part of our conversation where, and it's just kind of, it's just that sort of domino effect. So even though you might think, oh, actually I've experienced this and nobody else has, if you start that little step and saying, well, actually this is my story, you'll soon find that other people will suddenly start opening up as well. And I think that's maybe, part of the cultural shift that we need. But it's not, obviously the talking is good, and we all have got there's that whole thing about time to talk, but it's also about the support that needs to be there as well, because it's no good letting people open up, but then there's nothing for them to give them the support that they need.
Thank you, Barbara, and thank you again for your bravery, for showing and sharing your story. I know the impact that the words that you both had tonight, but in sharing your story, and I think us all speaking up about our experiences can make a huge difference. I know that we're going to look to wrap up fairly soon, but I'm going to abuse my power as the chair and take a question, because it's something that I applies to me quite often. So a question from Samantha. Hi, Samantha. She's saying, I have dyspraxia, which is a disability. And I was going to say, I'm also dyspraxic and dyslexic. So shout out to all our neurodivergent workers. And she said that she's also been medically shielding due to an immune condition, and she gets highly anxious and stressed with her dyspraxia normally. So the pandemic has really heightened that. Is there any advice there, specifically trying to think where perhaps the person is shielding due to a particular condition, but actually being neurodivergent or other conditions are really heightening that anxiety? I think the issue that Sam's talking about here is really how difficult employers find both intersectionality, multiple disabilities, a range of issues that can impact, or a range of identities that can impact people. Really difficult. They don't deal with complexities well. So what could we be advising Sam around that, or what would we be saying to her employer? And Rosena, if you want to start with that.
Saying phone Barbara, she knows everything. That's what I'd say. Oh look, Sam, you've raised something really important. Thank you. And again, you speaking out, Sam, is causing us to be able to have a very open discussion about this. And look, I think what makes our world so beautiful is that we're all different, and it isn't a one-size-fits-all model for how we live our lives, for who we love, what we believe, and it isn't in the workplace either. So when things are put forward in the workplace as to how to manage people, there has to be some slack in the system to understand that everybody is different. And when we look at our LGBTQ+ communities, when we look at our BAME communities, when we look at people who are neurodivergent, when we look at people who suffer with anxiety, it's about saying that there's room for everybody. Let's try and find ways to make this work for everybody, so that nobody should have to go back to work feeling a heightened sense of anxiety because there's something that makes them different from the norm. There is no such thing as the norm anymore. The whole idea is that what makes us special is the cross-section of who we all are. And that has to be celebrated, and that has to be understood in the workplace. And it is all our collective responsibilities to campaign for better rights for everyone. It is my responsibility to campaign for LGBTQ+ people. It's your responsibility to campaign for half Polish, half Pakistani, slightly nuts people from Tooting. That's what we're here for, to support each other. This isn't about what we can do for ourselves to make life better for people like ourselves. It's about saying, what can we do to make life better for everybody? And I think we need to make this all of our business. So Sam, I am sorry that you are feeling a heightened sense of anxiety going back to work because of something that makes you special in a different way. Because of that's unique. But your employers have to understand that element about you and have to make it work for you, and shouldn't expect you to go back into any environment that's going to make you more uncomfortable or more unwell being at work.
Brilliant, absolutely. So about celebrating our identities and recognizing the strengths within that, like fantastic. Barbara, same question to you.
Yeah, everything comes back to policies with me. It's like, what is the policy of your employer on neurodiversity? Have they got one? Because everything comes down when you're dealing with workplaces. It's like, what is the policy they're following when they're telling you that you know that and that is about this consistency of approach to people. Have they got a neurodiversity policy? And if they haven't, and you're a GMB member and you've got a GMB rep, then you need to be pressing that that's what they adopt, because we've got a very good model neurodiversity policy. And what reasonable adjustments are they making? Because we haven't even talked about, you know, reasonable adjustments properly, but they should be making those adjustments for you. So that would be my starting point, is what policy are they following? And if they're not, then you need to show them one, put one on the table and get the GMB one and give it to them.
Yeah, absolutely. Please do check out our resources on the GMB website. We have a Thinking Differently at Work, a neurodiversity toolkit on the equalities page at gmb.org.uk. There's lots of materials on there, advice for reps, checklists, policies, you name it, it's on there. Or please get in contact if you want any more information on that. I'm going to take, there's lots and lots of love being shown for Barbara and Rosena on our messages, which is brilliant. Barbara, thank you for being courageous. You're amazing. Thank you, Rosena. It's going to take time. Really great debate. Thanks to everyone. Very brave, Barbara. One love. Thanks, Rosena. This was so good. A breath of fresh air during COVID. Yay for GMB all the way. We like that. Yay. And Aaron, shout out to Aaron. Glad to have you here with us. So Aaron is one of our CEC members representing LGBT members and a rep. And he's saying, well done all, really great to see our union leading the way on the COVID-19 response in the workplace. So yeah, lots and lots of love there. I'm gonna, I realize that we're running out of time, or we've run out of time, but actually I think to round this up, and we talked about this before, about having having a magic wand. So we've had lots of conversations here about the things that need to happen in terms of education, in terms of policies in the workplace, in terms of support in the wider world. If you had a magic wand, how would you see ideal mental health provision moving forward? So what are the challenges in bringing those changes around? But really, in sum up, what would you like to see happen? What are the key things that you think need to happen first? And I'm going to go to Barbara first on that question.
I think I've said it already. I would like to see a Mental Health at Work Act, so that if you walk into any workplace, that you always see the health and safety, you know, the duty of care on that notice board. There should be one for mental health as well. And I think once employers are forced to act and know that they have to comply to the law, then I think that would make a big difference in what support they gave to their workforce.
Brilliant. Same question to you, Rosena.
Gosh, I'd do so many things if I had a magic wand, but I would want to see mental health and physical health have true parity of esteem, so that people adhered to, you know, the Mental Health Act, not because they felt they had to, but because they wanted to. And so for that, I would want mental health to be talked about from the moment kids enter school. I would want to end the stigma of talking about anything that also can be drivers of mental ill health. I would like to, you know, end the stigma of people being able to talk about, you know, being gay, so that they don't have to suffer with mental ill health for hiding from who they truly are. I would like our BAME, you know, community to be able to, you know, to feel they had safe spaces for talking about feeling unhappy to do things in, you know, in the workplace that they're asked to do. I would really want true parity of esteem. I'd want people to be able to call up and not be treated differently for saying, I can't come into work today, I'm feeling sad, I can't get out of bed, I can't stop crying. I'd like that to be as normal as phoning up saying, I can't come into work, I've got pneumonia.
Yeah, absolutely. Absolutely. And we talked about this before we came on tonight, about what one action or one feeling you taking away from tonight's discussion, and what one action do you think people watching could do around mental health? I'm going to go to you, Barbara, first. So what are you taking away, and what can people watching this tonight take away in terms of mental health?
So I'm going to take away that having known that these people, people are watching this, and I'm going to take away a lot of hope, because I think that means that this will, this will escalate. This will roll. People will start going away into their workplaces, and that's the action that people take away. Is they go back into their workplaces and say to their manager, "What is your policy?" And if that's the first action they do tomorrow morning on mental health, what is your policy on mental health? Then I think that will make me a very happy person.
And the same question to you, Rosena.
No, do you know what? I'm normally quite good for having an original thought, but I'm going to go with Barbara on this one. Hope was the word that came into my mind. I think this this whole conversation, has made me very hopeful that there are an incredible group of people, in the GMB, and I believe in, wider society, who really do believe in taking this forward. And I hope that after this, people do feel as though they are empowered to go into the workplace and say, do you know what, my rights are as important as anybody else's. And the one thing I want people watching to take away from this is, it is okay not to be okay and not to feel okay. There is no shame in feeling down, in feeling anxious. Most people are at some point, they're just not admitting it. And it's absolutely normal. It's okay. Reach out. There is help. And for as long as I'm in the Labour Party, and as long as I have this role, in me, you'll always have an advocate. And my door is always open.
Well, thank you for that, both of you, their colleagues. That's absolutely fantastic. If anybody wants to know, I think my word, and I'm stealing this again, I think from a speech of Barbara's at some point, it's about solidarity and action. I think our discussion has so much been recognizing how all struggles are connected, around so many different communities have been affected in terms of COVID-19 and mental health. And while we need to be providing those resources and support for those most at risk, it's seeing that this is an issue in society and that we have to support one another with it. And my action is always going to be, if you're not in a union, if this has not persuaded you that there are reasons why we have to take collective action, while being on your own in a workplace is not enough right now, please do go and check out some of our reasons and information on joining the GMB. For more information, it's at www.gmb.org.uk/join-GMB. There's also lots of information on COVID-19 and thinking about PPE, thinking about risk assessments. So please go and check that out on the website. We've got a COVID-19 hub, a PPE hub, and a huge amount of information. GMB is also going to be doing work around mental health. We absolutely see this as one of the priorities right now, preparing for the mental health crash that we believe is coming. And so we're going to be sending out an email to all members in the coming weeks asking about mental health. This will be anonymous. Your manager will not see this. No one else will see this. The information will be anonymized, but really looking at, what is the size of the impact and what can we do about it? So please check out and look out for that email. And if you aren't a member, it's still not too late to join. But we think this is one of the biggest mental health surveys that we think is happening at the moment. Our 600,000 members will be sent this email, and this is really getting a snapshot of the size of the problem and what we need to be doing to tackle it. So I think that probably leaves us just to say thank you again to our fantastic speakers, to Dr. Rosena and to Barbara. Thank you so much for your honesty, your bravery, and all the work you are doing. And then thank you to all of you that are watching tonight. Thank you for your support. Thank you for all the amazing things that you are already doing in supporting other workers, in keeping us going and looking after us when we're ill, in fighting for your colleagues and fighting for your rights. I know so many of you I can see in this list are just really leading the way on this. We are so proud that we are together in a union. I'm going to leave you on that note to say we wish you all well during these difficult times. We're going to be looking to put out more information and maybe even do this again if people are up for it. I feel like it was a good use of my time. I hope it was for others. And we will hope to see you again soon. So take care and good night.
Thank you so much.